Hi, my name is Sharissa. I'm a registered psychotherapist. I do take an integrative approach because I think there is so much different types of therapies that are beneficial for people. So I like to kind of pull in different things that I've learned over the years. And if I think they apply, I bring that into the session. My experience has really helped me to take a person centered approach. In simple terms, that just means really meeting people where they're at, taking a look at all the context of an individual, getting a more holistic perspective on that. I've tended to focus on people experiencing symptoms of like depression, anxiety, going through maybe difficult life transition, and like low self esteem. The reason why those kind of drew me is because I think for a lot of people, when you speak about those topics, they can relate, they can connect, they've had some sort of experience, whether it's sadness, whether it's anxiety. I just think it's really relatable, and I want to help as many people as I can. What is important to the therapeutic relationship? First of all, is being present, actually focus there in the moment, making sure you're not distracted, preoccupied, because that can happen too, being well aware of that. And then, second, I think coming from a really neutral, like non judgmental place, which luckily for me, I feel that that comes pretty naturally. I like to come at people with a neutral perspective, like seeing the good in them. Psychology in the past has maybe focused on the negative and labels. So I really think it's turned around to acknowledge that it is very natural and normal to have ups and downs, to have concerns, to go through things. So just normalizing that. And I'm also open to feedback. I definitely welcome that because I know I'm not perfect. I know that just like anyone, I can make mistakes or maybe even be like misinterpreted. So I like to encourage that honesty in session. So, in terms of the first session, the nerves and possible discomfort are completely normal. You don't really know me. I'm someone that's a stranger, so that makes total sense. So, I like to leave it pretty open in terms of I don't have necessarily a set amount of questions or a checklist. For the first session, I'll tend to focus on like what's going on right now. So I think that's pretty helpful in terms of like where we can start the work. Getting a person's background and history is important too. So I think like one important takeaway that I would want to bestow onto a client is a sense of empowerment. And I don't want to minimize or to like just gloss over whatever people are dealing with. I mean, it's real. I do want to give a sense of empowerment in terms of what can you control? What can you work on? What is in your immediate circumstances that there's a little space to make some improvements? Because I think like those small steps really add up.